Thank you, Governor. Good afternoon, everyone. As always, thank all of you for tuning in and for helping us get out accurate information when it comes to COVID-19. And I also want to echo that thank you to our manufacturers who are looking to help all of our healthcare workers who are Rhode Island's unsung heroes on the front lines. Now, because of their effort, the healthcare workers who are actually caring for COVID-19 patients who have COVID-19 virus, actually will have the gowns that they need to be able to wear the full PPE in those specific situations needed. So that's important. We want to continue to make sure that our healthcare workers on the front lines know how valuable they are and that they have the equipment they need to do the work necessary. So to jump in, as the governor may have said, we have 218 new cases. Of our COVID-19 patients, 266 are currently hospitalized. Of those 266 people, 84 are currently in intensive care units, and 55 of those 84 are on ventilators. We unfortunately have 6 new COVID-19 associated fatalities. These people range in age from their 50s to their 90s. And our thoughts and prayers go out to the families of these people and to the families of everyone who have sadly passed away over the course of the last several weeks. We certainly understand that that has not been easy. To share a little bit more, of these 6 people, 5 of them lived in nursing homes, and 1 person lived in another congregate living setting. We are going to need to continue to be very vigilant in nursing homes, other congregate settings, and hospitals when it comes to all of the approaches that we are taking. That includes the visitor policies, that includes screening of staff persons as well, and it includes wearing the masks that the governor has required for healthcare workers and staff workers taking care of patients in nursing homes and in hospitals. People in congregate living settings, like nursing homes, tend to be more medically fragile, and just living in a congregate care setting places such people at higher risk. That means the virus has an easier ability to spread because people are living closer together, and it's a population that is more medically and physically fragile. However, an important piece of context is that we are announcing newly confirmed COVID-19 associated fatalities when I talk about the numbers each day. This is the national reporting definition, and it's how CDC collects and shares COVID-19 data. For many people who pass away, COVID-19, along with other factors, are often involved. For some people, underlying medical conditions are actually in play. And for all of us, our immune system ages with us. Our immune system is the system that allows us to fight off infections. That means that as our immune system function declines, so does time. As someone ages, their immune system can decline. This is part of why people in nursing home communities may be at an increased risk of infection with COVID-19. I share this context because I want people to understand that assisted living and nursing home staff and administrators and those working in those facilities are all working very hard to keep the residents in their care safe. The same goes for all the healthcare workers and other staff who are in individuals' homes through home health agencies. They love the people in their communities, and this has been an enormously challenging time for all of them. They are doing everything they can to keep people safe. For example, they're working with us to ensure that the testing that we said is needed to continue to do cyclically, repeatedly, in these settings is happening. We are working to get all residents and staff in all homes tested. There's a tremendous effort to do that so that we can better understand the landscape in these congregate care settings. Testing is one of the key focal points for us in preventing transmission of COVID-19. We know that expanded testing in other high-risk environments outside of congregate care settings is also important. We have our eyes laser focused on being able to expand testing in our communities that have been disproportionately impacted. The governor shared some of the walk-through sites that are occurring. We know for the immediate time frame and for the long-term future, it's going to be important for us to have an expanded testing system that allows us to better understand what we need to do in the communities at highest risk. Because testing is most accurate with symptoms, when testing goes beyond that, it must be guided by public health in determining the best way to do it and how to have the interpretations best understood. As we've shared, we want this process of reopening the economy to be science-driven. We want to minimize mishaps or misinterpretations and help everyone understand what we need to about testing when we are doing it in specific populations and groups. We know that testing is just one point in time. Someone could get tested today, have a result, and then have a different result or outcome the next day if they were exposed to someone. That type of understanding is why public health guidance is important as we move forward. It's also helpful to know that there are several measures with testing, which is one tool in the toolbox, that we are focused on to make sure that everyone stays safe as we're reopening the economy. The governor shared about the importance of contact tracing. We want to have expanded testing so that we can engage in the expanded contact tracing system. That's important, very nicely and importantly supported by technology, as has been shared. We also need to continue the services for quarantining and isolation, because that, as we know, is the key for helping to stop transmission of this virus. And we also need to continue taking the personal protection measures that we continue to discuss. That allows me to reiterate the stay-at-home order continues to be in place. That's what's going to allow us to move forward. We all need to continue avoiding groups of more than 5 people, continue to wear cloth face coverings when in public, continue to wash your hands multiple times through the day, and continue to keep a distance of at least 6 feet from each other whenever possible. Those are the core principles we have to being able to stop transmission of this virus and to continue to keep Rhode Island ahead of this as we get through it together.